Love and health form the foundation and pillars that support all that you do to create fulfillment and success in every aspect of your life. Love within us guides our paths while our health enables us to drive forward. The two are inseparable and vital for growth and reaching your fullest potential. Welcome to Love and Health in America with Dr. Doohi Lee and Jens Johnson. Dr. Lee is an international speaker, author, inventor of the Diamond Matrix, and medical director of Advanced Surgical Arts.
The way I see my role is that I'm a guide.
Jens Johnson, the mindset master, is a best-selling author, speaker, and executive managing director of Dallas E-Women Network. Please join them and explore all the facets of love and health to achieve and live your abundant life. Here are your hosts, Dr. Doohi Lee and Jens Johnson.
Another episode of Love and Health in America. Now, we've got a really, really great show for you today because we're going to be talking about the brain.
Exactly.
We're going to be talking
the most important part.
The most important part. And I don't know about y'all, but and I told Dr. Lee, I said, Dr. Lee, we got to talk about some of the crazies. And it all starts in the brain, folks.
Yes, definitely.
Now, here's another thing that we're going to do today is I've got my phone here. And if you've got a question, a specific question that you would like to ask Dr. Lee, put it in the comment box and I'll ask him for you. So, Dr. Lee,
yes.
as we know, you have created the Diamond Matrix.
Yes.
And one of the components of the Diamond Matrix is it's the brain.
The brain health. Yeah, that's the foundation. That's at the bottom.
And so let's talk about the foundation of the brain,
exactly.
Because whether we realize it or not, we've got a lot of people trying to manipulate our brain.
Oh, constantly.
And I told Dr. Lee, I said, Dr. Lee, we got to talk about this today.
We're going to talk about it
We're
today.
going to talk about it. So let's jump into what you do with the brain.
Okay. So what I want to do today for everybody out there is, it's going to look like a little classroom, but I've shortened up my lectures on brain health and called the Spect scan. And what I want to go over and hopefully do a little teaching today is to kind of let you know how the brain works and the kind of tools that I use to figure out how you can actually see the brain. Because one of the things that people kind of get hung up on the brain is, well, we don't know what's going on. People get MRIs and CT, and those kind of results that people know all the time. But question has to do with how do we know how the brain is working? What are the functionalities of the brain, and how do can we actually see that? And so I have a tool called the Spect scan, and I use that to really analyze the functionality of the different parts of the brain, and that really gives me a clue to what's going on that may be associated with different conditions like ADD, depression, anxiety, and all the kind of stuff that people go through. And I just want to go through this really quickly and then do a little quick slideshow, and after that we can talk about some more and about how I use this information to treat people. So Chris, if you can start the slideshow. So let's go on to the next one, Spect brain scans. And so it's the Diamond Matrix that Jens mentioned. So you have the 7 components there, and nutrition, lifestyle, etc. And the B at the bottom is brain health, and that's what we're going to be concentrating on today. And I put that on the bottom on purpose because it really serves as a foundation for the Diamond Matrix and everything else that goes on inside. So next one. So I kind of came up with this term called holistic health of the W, because it really is entire encompassment of the various parts of health. So again, brain health is foundation of health, and then I use a Spect scan for looking at the organic brain function, and really it gives you an objective view of the functionality of the brain and the different deficits. And as I mentioned before, it is associated with ADD, ADHD, dementia, traumatic brain injury, addiction, so many different things that we go through every day. And the reason this is important is because as we get older, cognition declines, and whether we want it or not. And I'm personally going through it myself. Like, oh my God, this is not good, right?
This to happen.
So I'm doing everything I can to fight that process, but understanding what's going on with declining and changes with age is really important. And then, figure out a way to optimize your brain function regardless of your age. And there are ways to do this to keep your brain working sharp and crystal clear all the way through your old or mature age, I should say, with various supplements and diet and lifestyle and things like that. And that's the whole point of evaluating the brain health. Next one. Next slide. Okay, so the brain is the most complex organ. I mean, it just, sits up on the top, and there are multiple different things. And I don't want to go through this complex slide, but it really demands a lot from the body. 15% of cardiac output, 20% of oxygen, and 25% of glucose. That goes to the brain. It's very demanding, and really is the most important area. And the way I explain the brain to my patients when they come into to see me is that it's a little like a car engine. That's you driving down the road. We're driving our Ferraris, right? Driving down the road, and you come to a stop because all of a sudden something stops. You open up the hood, and the engine itself looks great. It's like nothing coming out. There's nothing leaking, etc. But the engine is made up of thousands of parts, and the brain is made up of billions of neurons and trillions of connections, and it's very, very complicated. So it's not just the entire structure itself, but it's actually the different parts that may not be functioning properly. Maybe there's something little, valve that's broken inside the engine that causes it to stop. Similarly, in the brain, there may be different areas in the brain that specialize in other tasks that are not functioning properly, and that causes different kind of problems to occur. And that really is the whole idea, is to figure out, what are those areas and how do you actually detect those kind of things.
And obviously, you don't know what's going on inside your brain.
Exactly.
So it's not like, you're going to go and do an x-ray.
Right.
You don't know what's going on inside, but what is going on inside in your brain dramatically impacts your quality of life.
Everything. It impacts everything. So it's sort of an oxymoron. It's a little like, hand trying to fix your own hand, if you're a surgeon. Brain trying to fix your own brain. It's like you have to kind of think internally, and that's kind of what we're doing. And the only way to really fix that is to be able to see it.
Right.
And for now, SPECT scan is really the only way to really be able to see the functioning of the brain, and that really is the key. So let's go to the next slide. Next one. So SPECT and time. So why do we worry about the brain health? Because if you look at those pictures, the one on the left is nice, smooth, homogeneous brain. That's a nice young brain.
That's what my brain
That's what we all want.
I have no doubts.
No doubts. Exactly.
I have no doubt that's what my brain looks
and
like.
unfortunately, as we get older, we get a little irregular, and those little areas that are spots, and sometimes we call them holes. You don't really have holes, but these are the areas where there's a little deficit in the blood flow, and that's kind of what happens as you get older.
And what causes those holes?
Well, it's a lot of things.
Could it be your spouse?
Could be spouse. We're going to talk about the spouse thing later.
Could it be your
different
spouse?
Spouse, stress, work, different metabolic disease, diabetes, medications, all kinds of things, right?
So all different things.
So many things. Okay. Everything that goes into the body.
But all those holes impact the functionality of the brain.
Precisely. Because those are the areas that the blood is not getting there.
Okay.
So next one. And then, so how do we decline? How do we actually figure out why it's declining, and how do you minimize that or even prevent the decline, actually even reverse it? So the whole idea is diagnose it, treat it, and then maintaining the health. Next one. So there are different ways to look at it. So anatomic imaging is MRI and CT, which we know, everybody's familiar with that. That kind of tells you how it looks. And pretty much everybody that I see in my clinic for the brain evaluation, they all have pretty much normal MRI and CT, unless they have some history of surgery or trauma. So that really doesn't help us very much. It's like opening up the hood and looking at the engine and say, hey, engine looks great. Why isn't it running? Okay, so that's kind of what the anatomic thing is for. So it's the functionality that's truly important. Why is it not working? Not necessarily what it looks like, but why is it not working? There are different things like PET and functional MRI, but they really don't give you the kind of information that I use in terms of the SPECT scan, and that's what we're going to concentrate on. Next. So this is a SPECT scanner. I have one in my clinic. It's a small little, looks like a tiny little miniature CT scan, but they have cameras out there. You lie on the table. It makes a little whispering noise and goes around and takes a nice picture. And what we're doing is actually looking at the blood flow pattern in the brain, and we're translating the blood flow pattern into function of various areas in the brain. Next. So here's an example of a nice normal brain.
Cotton candy.
So, cotton candy, yeah, you remember.
Yeah. Cotton
So I always
candy.
kind of use the analogy, like if you all go to different carnivals and fairs, there's always a guy making cotton candy, and there's nothing like a fresh cotton candy right outside of it. You get a little stick, this nice fluffy cloud is sitting on a stick. It's very beautiful and soft and all well-rounded, right? So nice, healthy brain looks like that on a SPECT scan. Really beautiful,
and
smooth.
How old is this person?
This person's in the probably early 20s.
Okay.
Early 20s, now. So,
right.
But even you can be older and have this kind of brain. You can be
I
very
know,
healthy.
mine is that way.
Yes, I know.
I have no doubt.
Exactly. So that means every little tiny micro vessels are filled with blood flow. That's
Right,
why
okay.
everything is so homogeneous and smooth, which means every neuron and cell is getting the nutrition it needs, so the brain is functioning at its peak, and they really don't have much functional deficit. That's what we're doing. So I want everybody watching this to be envious of this beautiful, homogeneous, fluffy cotton candy brain,
Right.
because that means a really nice, healthy brain. Okay, next. So what happens? Unfortunately, things happen in life, and we go through different effects, on the brain, and different abnormal changes occur in different areas of the brain, and that sometimes translates into different conditions we have, things like ADD, depression, PTSD, trauma, dementia, bipolar disorder, OCD. The list goes on and on and on, and all those different conditions are associated with different functional deficits in various parts of the brain. So what we're doing actually is looking at the functionality and translating it back and associating that with various conditions.
Right. And here's the thing.
Next slide.
You're looking at ADHD, depression, addiction. Those are major issues that people are facing. And if they had this brain scan, they would clearly understand what part of the brains are not getting the blood flow.
Yeah.
And there are things you can do to help.
Exactly. That's the whole point of this. That really is the whole point of this. And this is the first, people who come and see me and go through this evaluation, for them, it really is the first time they're actually seeing their brain and how the brain is functioning.
Right.
And it does a couple of things. Number one, it objectifies it, so they realize it's not all in my head, no pun intended, because it is in your head, but people say it's not imagining it, because sometimes people go through this, and they go through this, almost trauma of evaluation, treatment. Nothing changes, and you wonder what is going on. Am I crazy?
It's that hopelessness.
Exactly.
And that's the thing is if you're suffering with depression, if you're suffering with issues, you really do start to think I'm crazy. There's something wrong. And listen, I tell people all the time, everybody's at least a quarter crazy.
A little bit, yeah. You have to be.
At least a quarter crazy,
yeah.
And I think that might be generous, right?
Yeah.
But if you're suffering, it means there's something wrong. That's one of the things I say all the time is your body is such a tremendous machine, and when there is a problem, your body will alert you and let you know.
Of course. And
so
brain
it's
does the
not
same
in your
thing.
head.
The
There's
brain does the same
something
thing.
going on.
Right.
And this, of course, this type of treatment or this type of scan allows you as a physician to be able to hone in exactly what is the issue.
Exactly, yeah. That's the whole point of it. So let's go on. Let's go to the next one. So here's an example of ADD, ADHD. Okay, so what's interesting is in the baseline scan, I do two phases. One is when your brain is resting, another one when the brain is active. What's interesting is that when you're resting, there are several areas of a bunch of little holes. I'm going to call it holes, but they're not holes. And then when you're active, actually it decreases even more. The holes get bigger, more diffuse. And this is sort of a tragedy, because when you're concentrating, that's when you need your brain to be functioning at its capacity. Instead, by looking at the scan, when you're doing that, the brain actually shuts off and the blood flow is decreasing.
Okay,
that's
so
why you're not able to concentrate and you're all over the place. That's your typical scenario of what people go through ADD, right?
Okay, so that's crazy. So
now you can see that. Now you can see what's happening.
What you're saying is when somebody has these holes in their brain, and they start on a task. They want to start working. They want to start doing some type of work where they need focus.
Projects, writing,
That's
all kinds of things.
when the blood level
drops. Falling down, yes.
Oh my gosh.
See, but thing is, can you go back to the slide again? But that slide shows you exactly what's happening. When you're resting, your brain is actually more filled in. Okay, but when you're working, concentrating, that area that determines your focus and your concentration is actually shutting off.
Right.
So no wonder your mind is wandering everywhere. You can stay on task.
That's a mean trick.
I know, that's what happens.
That's
but
a
what's
mean
interesting
trick.
is on the third slide, on the right side, we put patient on Adderall, that actually changes the blood flow pattern in the brain. So you can kind of see on Adderall, there's significant improvement in the overall feeling of the brain. So your brain actually functions better. That's why some of these medications actually help you concentration, because it changes the blood flow pattern.
Okay, so the third picture on the right, that's with Adderall with someone working.
Yes.
Okay.
Yeah. So there's a significant difference.
Significant.
I don't want to go into all the biology because that's too much for this talk. But there is definite effect of medications, and I tend to stay away from medications, but I do use them once in a while. But even the other stuff that I use that are non-medication really do affect the brain, improve the functionality and blood flow. That's how people get better.
Okay.
But this is a really good example of people seeing this. So when they come into the clinic and get the scan done, and I show them this is what's happening, they realize, oh, now I get it. No wonder I'm going through this problem, because because my brain is shutting off when I need it the most.
Right.
Okay, so, next slide. An example of depression, this is a 17-year-old with depression. So this is a different kind of scan. It's actually showing the actual internal parts of the brain. And the picture on the bottom actually is showing the outside, the cerebral cortex of the brain, okay? So what's interesting is that you're seeing a lot of activity in the areas that are associated with different emotional stability and depression. The one in the middle is called the thalamus, and has a lot to do with the emotional barometer. And on the bottom, you can see, again, a lot of big holes in the frontal lobe and temporal lobe, which actually has a lot to do with mood stability. All those areas are actually shutting off because you're not getting the flow. So no wonder this person, 17-year-old, is depressed because your brain is not functioning enough to keep your mood up. Okay, so here's an example of why different areas of the brain are resulting in this type of depression. Depression is not a diagnosis. People use depression all the time. Well, I'm depressed, I have this, and people give medication on depression. Depression is a symptom. And unfortunately, somehow, the way we treat people, we use it as a diagnosis, and we give antidepressants instead of really figuring out what is the cause of your depression. I mean, if your thyroid is low, nothing to do with the brain. If your thyroid is low, hypothyroidism, you can get depressed. Okay? So do you just treat the brain, give antidepressants? No.
But would you, say somebody does have a thyroid issue and they are depressed and they're not quite sure what's going on.
Sure.
But they want to come in because they want to see what is happening in the brain.
Yeah.
You're going to see in the scans the impact of the loss of the flow. But can you see if somebody's depressed from the scan and then say, "Hey, look, we can." I mean, how do you know it's the thyroid? That's what I'm trying to get.
part of the analysis. Part of the evaluation, not only the scan, but there's
Right.
pretty extensive history taking.
Okay.
Evaluation and talking about hormones and all those kind of things. So I cover all those kind of things as part of the initial evaluation.
Okay.
It doesn't just come in here and get a brain scan.
Right, I
There's
got
a
you.
lot
I
of
got-
interaction and
Okay, I got
talking,
you.
and this is a pretty complicated process.
I know you're very comprehensive, Dr. Lee.
I'm sorry?
That's what I love about you. You're very comprehensive.
Oh, thank you.
You
Yeah.
know, and that's one of the things that I know sets you apart from so many other people is when somebody comes in to see you, you're looking at the entire picture.
Yeah, trying to,
and you have the medical training to look at the entire
Yeah,
picture.
yes.
Where most physicians, nothing wrong with that, but most physicians are very specialized, but you have a lot of specialized training in a
these
lot of different areas.
Yeah, I try to use all those different tools in
Right.
the toolbox. Yeah. Okay, let's go to the next one. Next one. And addiction, this is something that is rampant, and especially now with coronavirus, people isolated, all those kind of things, use of alcohol, drugs, and even abuse, and all those kind of things skyrocket. We don't talk about it much, unfortunately, but this is really a tremendous problem. And we know the opioid epidemic we're going through. Really, I think President Trump has made some inroads in that, but it's such a huge problem. But so we're going to talk about addiction because obviously there's a very, very critical part of brain dysfunction. So next slide. So here's an example of addiction. So here's a healthy brain. We saw that before.
That's
Picture on the
7
right.
years old?
7 years of methadone use.
Oh, 7
And
years.
some
of-
prior
oh
heroin.
My gosh.
Look at what happens to the brain.
Oh my gosh.
I mean, there's very
and
little
is that
brain.
at rest?
It doesn't
Is that
matter.
at rest?
It doesn't matter if it's rest or not. This is what the brain is. So think of how little brain functionality is left.
Oh, it's so
after
sad.
It is sad. This is what
It's
happens
so
with addiction.
sad.
Yeah. But what's amazing is that if you stop, you'll come back. The brain comes back.
Right.
That's the
brain-
amazing thing
that's
about
what,
it. The brain actually can heal itself. Yeah, and even with smoking. I have so many other examples. I just don't have time for all of it.
Right.
But what is really amazing is that you can see that there's kind of a tremendous deficit in the brain functionality that is low. But once you go through treatment and make the brain healthier, you will start to come back towards healthy brain. Okay, next slide. And then another example. So marijuana. We just came out in the newspaper. Several states passed, recreational marijuana.
Right.
Okay, it's going to sweep the entire country. Eventually,
Right.
Texas will become that too as well. But look at this: 18-year-old, 3 years, 4 times a week marijuana. Look at the deficit and the brain. Oh, look at all the holes, right?
Right.
28 years, 8 years of heavy methadone use, and then the third one, long-term alcohol use. Okay.
Yeah, so let me ask you,
Yeah.
is alcohol worse for the brain?
It's horrible for the brain.
Yes, well,
It is horrible for the brain.
makes
It's
me-
poison.
Well, it makes me so sad
yeah.
because I know a lot of people.
I
Obviously,
mean, we all have little drinks here and there,
I know,
obviously, but
I'm thinking about the abuse of alcohol.
Yes, exactly.
So and just the abuse that alcohol has on the body. So when someone is an alcoholic,
Yes.
it's devastating on the body. Now, do you have the same damage caused by marijuana use to the body as you do alcohol?
similar. I think it affects different areas of the
Okay.
brain. Can you go back to the slide again, please? So if you look at this is sort of the I don't know the right word for it. It's sort of an oxymoron or something that goes back and forth. If you look at this, let's go back to the other one. So this is unfortunately what's happening. So if you get to a certain point of having this kind of a brain deficit, okay, and you realize I can't keep doing this. I have to save myself, quote unquote. But your brain is so damaged, the areas that give you the motivation and the understanding and the drive to improve yourself,
You don't
that
have
is
it.
damaged.
Yeah.
I mean, you still have it, but it's just
It's
not
so
that
damaged,
strong.
right.
So even though you want to heal yourself, the motivation to allow you to go and heal yourself becomes low. So you constantly keep falling back. And that's the tragedy behind this kind of a level of addiction. You're damaging your own self to the point where you cannot heal yourself.
Well, and the thing that's scary too is I just think about with this isolation how alcohol sales are up through the roof because
Crazy,
people are
crazy.
self-medicating
Exactly,
themselves.
because that's all they have.
And then people are in this state of fear because how the world has politicized
Yeah.
the health situation that we're in.
Right.
And so, what is the negative impacts of all of this craziness happening in the world on our brains?
Oh my God. Well, brain reacts to the environment.
Right.
Okay. If you have constant onslaught of negative energy coming to you, your brain is going to adjust and adapt to the negative energy. There are some of us who are strong enough to fight that and maintain your integrity and self, but even those people eventually wear out.
Right.
There's only so much that we all do. But if you can find something that's positive, that'll reinforce the positive energy of your brain as well. So exactly what you're saying. We're in this tremendous pandemic, and the way our country is responding, and I have my own opinions about all of those kind of things too. But that negativity, this dark winter that we're talking about, that's coming.
Right.
I mean, that's going to have even more effect. Bad effect in this country, not only individually for the entire nation, to be that draconian about this pandemic, instead of finding a positive direction to figure out a way to get ourselves out and truly find positive paths to live our lives in spite of this pandemic.
Right.
Okay.
And that's why it's so important that we realize as human beings, as individuals, that we can't buy into the negative
Exactly. The
narrative that has
yeah.
that truly is shoved down our
It's
throats.
brainwashing. It's brainwashing.
It's shoved down your throat. You can't watch the mainstream media. The mainstream media is the enemy of the people. I mean, it just is.
I agree.
And what people don't realize is they know this. They know that just putting negative and negative. They know these are tactics that have been going around the world for hundreds and thousands of years. The negative propaganda to get people to be scared and all of that stuff. Of course, what I do as the mindset master, as a coach, as a mastermind facilitator is it's getting people to focus on the positive, getting people to focus on love, getting people to focus on what you can do, because we have a lot that we can do. And I'm telling you, turning off mainstream media,
that's the first
thing. And not believing that. And the other thing I say all the time to people is, listen, I don't care what side of the aisle somebody is on. Right. We're more alike than we are different. And we need to love. We need to love one another.
Yeah, find common ground.
Find common ground, and we need to see things like what you're sharing with us right now, because it's detrimental to your brain.
Not only your
health.
brain, your entire body and self, and your soul and everything. So, but that's exactly right. So I have a few more slides. So let's keep going. We can kind of get through. Let's go to the next one. And then, so this is a traumatic brain injury, obviously same kind of picture from probably sports injury or motorcycle accident, things like that. But again, you can see the physical defects. But actually, a lot of these people, unless they actually had physical change, the brain scan, like MRI, will look pretty good. But because of the trauma, there's significant difference in the functionality of the brain. That's what this scan shows. Go ahead, next. So other conditions, PTSD, anxiety, dementia, et cetera. So many other things we can do. But one thing I put this in couples therapy because we talked about this before. One of the things that is sort of an interesting use of this is, a lot of people go through marital issues and all kinds of, difficulties because, this, passionate relationships are not the easiest thing to live with, right? So
You
sometimes
can say that again.
sometimes people have different functional deficits as a couple. And sometimes these functional deficits always cause a clash rather than harmony. And so an interesting idea is, scan the couple one at a time and then figure out, okay,
Can you
you have a deficit in this area and you have a deficit in this area. And unfortunately, these deficits don't do very well together.
I really want to do this, Dr. Lee. I really want to do
It's sort of,
this.
anyway, it's sort of a fun idea, but it actually is very practical and it has real validity to it. It's not something that's fluff. But to be able to really kind of analyze the functionality of, the wife and the functionality of the husband and really kind of figure out, okay, because of your functionalities, you react to these the stresses differently. And that those kind of reactions and how you adapt to them may cause a lot of stress between the two of you, depending on your interactions.
Right.
I mean, we all know about how different people push each other's buttons, right?
Right,
We know what
exactly.
the buttons to push
That's
for
right.
your loved one because we know them so well. Well, okay, so since those buttons come from understanding the functionalities of each other.
Right.
I mean, we're looking at the scan, but we just know as people, okay, he's going to say this, she's going to say that, I'm going to say it this way to make her mad or something. We all do this all the
Right.
time. So people who are really going through some difficulties in their relationships, this may be something interesting to kind of go through, figure out, okay, I have this, I have that, you have that. Let's see how we can harmonize,
Right.
improve those areas of deficits. Maybe they'll allow us to get along better.
Right.
And, rekindle the romance and love and all those kind of things too.
And I love that you're talking about this
Yeah.
because one of the things, and one of the things I've said when I first met you, and we
Yeah.
started talking about the brain, and you started to share and impart your wisdom. That's the first thing I said. I want my husband to get his brain scan. I want my husband to get his brain scan. I want, of course, obviously, having both
Sure.
people do it would be phenomenal because, to your point, look, if you have struggles.
Yeah.
And you're not dealing with the specific cause because
Yeah.
you don't know it.
Exactly.
You're always going to have struggles.
I know. You don't know why you're fighting.
You're always going to have struggles.
Yes.
Exactly.
Yeah.
And to be able to identify what those are. And, another thing just popped into my brain here is here we are in November, and for a lot of people, this is open enrollment time.
Sure.
And I know that, well, I shouldn't say, does insurance pay for this? Is what
This
I want
one?
to know.
Well, it kind of does.
Uh-huh.
For me, it's so variable.
Right.
So I just accept cash. I have a set price for it,
Right.
and then I give them all the diagnostic papers and whatnot. So everybody files for their own insurance, and they get back whatever the insurance pays them.
Right.
So if you have great insurance, you get pretty much almost all of it back.
Right.
If you have crappy insurance, then you're going to get a little bit back.
But
So-
one thing I was thinking about, because this is open enrollment time, is a lot of people, there's a second insurance, a
Yeah.
secondary insurance.
Right.
And if this is something that somebody would be interested in, and you talk with a health insurance person, a lot of times you can get a secondary insurance plan policy
Oh, really? To
for
cover
a
things like this?
given year
Oh,
where they
wow.
would, even if your primary insurance would only pay for a little bit, or maybe your primary insurance isn't all that great,
Yeah.
and it wouldn't pay for very much at all, but you had the secondary
Secondary.
insurance policy
That's
that would
interesting.
pay for 100% of
Yeah,
it.
right.
And you say, hey, look, we're in the pandemic.
Mm-hmm.
Things are not normal for us.
Right.
You're stressed out. Maybe you are having problems with your spouse, and you wanted to do this for 2021. This
Sure.
would really be the time
Definitely. That's a
to
great
look
idea. That's a
into
great
that
idea.
secondary
Sure.
insurance.
Right.
And I know so many people
People do that,
that's
yeah.
what they do for a living. So if you are interested
Wow, it's a great idea.
whatsoever,
Yeah, that's a great
not
idea.
only do we have the man with the plan to do the
the scan
scans,
evaluation, right,
but
yeah.
reach out to us, put your name in the comment box. We can get you connected with somebody that could talk about that
Sure.
secondary
That's a great
insurance
idea.
policy.
That's a great idea.
Because I don't know about other people, but for my husband and I, we've got 5 kids,
Sure.
and we know there are some things that you can elect to do, other things that you can't.
Sure.
But let me tell you what, the stress that people have been under
I know. Yeah.
in 2020,
It's
I think
just-
everybody should get their brain
I
scanned.
think so.
I really do.
Yeah,
So it's
I
a
know.
it's a definite way
Definitely.
that they can make that happen.
I know. Okay, so let's go on. I want to talk a little bit about the next one. What how your brain can change. This is the next one. So actually can go from very very dysfunctional brain to actually fairly healthy, much more functional brain. And brain actually has the plasticity and the ability to actually change and improve itself.
And that's great news.
That's the only reason I do this, because scanning is fantastic. Looking at all those scans are great, but if you can't do anything to improve it, it's sort of just an
What's the
exercise of
point,
futility.
right.
So, but you can actually do this. So next slide. There are different types of treatments. So here's one, obviously, abstinence from bad things, like, 1 year of alcohol and drug-free. Look at the difference between the left and the right on the top picture. Another one on the bottom, substance abuse versus 1 year alcohol and drug-free. So just by not doing the bad things to your brain, actually brain can improve,
Right.
which is fantastic, and you can do other things as well. Next slide. And then, we know about hyperbaric oxygen chamber, improving the oxygenation of the brain. For those of you who are not familiar, hyperbaric is actually an oxygen chamber. You can sit in this tube, they increase the atmospheric pressure, and you're actually having 100% oxygen coming in. So you're getting a very, very high dose of oxygen for a short period of time that improves the oxygenation of your entire body, and certainly including the brain. It has a tremendous benefit in terms of reclaiming a lot of the functionality of the brain as well. So you can see the before and after picture from hyperbaric oxygen therapy.
Okay, I want to
Next.
ask you a
Yeah,
question.
sure.
So, wearing the mask, does that impact the amount of oxygen that you're
Yeah, it does
receiving?
decrease it. It does
Okay.
decrease it, but I don't think it's to the point where it's really. Obviously, if you wore it, kind of nonstop for 18 hours, I wouldn't advise that, because
Right.
a lot of people have a lot of different problems with it. But for the short time that we go through in and out of the stores and kind of things that we do, that really is not a problem. I mean, sometimes when I'm operating, I'm wearing down mask for 5-6 hours for
Okay.
a long case. So, but it's not going to really affect
All
you
right.
that much. So, yeah. Next one. Again, treatment, this is with medication. So ADD and anger issues, you can see before and after. In the top, you have the pre-treatment, a lot of the areas of deficits. On the bottom, with Adderall and Decapo for temporal control, you can see the difference in the brain. It's not perfect, obviously, but certainly significantly improved with treatment, and that is reflected in the change in the flow. Go ahead, next slide. Depression, anxiety, same thing, antidepressant medications. This one person actually went through EMDR therapy. It's non-medical. It's actually exercise. So it's a combination of different kind of medications as well as exercise. I use a lot of supplements and non-pharmacological treatment. That's just my inclination
Right.
to treat people, and that's how I'd rather bring about positive change rather than putting them on a bunch of drugs. And I just don't, believe in too much pharmacology. 'Cause
Right.
you're fighting the secondary effects of these drugs more than sometimes the primary desire. So anyway,
Makes
next slide.
sense, makes sense.
Next slide. So it really is the foundation of holistic health, and so this really has to do with really for people to visualize the functionality of the brain for the first time probably in their lives, and that allows to really finding out and diagnosing what's going on, the different areas of deficits and imbalance in the brain function that allows you to kind of find the right kind of treatment, because different supplements affect different areas of the brain, and by knowing this information, I can kind of recommend and do quote unquote prescribe these kind of supplements and therapies to target certain areas of the brain. Some people have problems with the temporal lobe, some have problems with basal ganglia, which gives you anxiety. Some people have the problem with the frontal lobe, which leads to ADD, ADHD, and procrastination. So we can target all those areas and give you different kind of treatment patterns, to affect that. And again, the whole point of this is the idea of neuroplasticity, in a sense that the brain is plastic and is elastic and can adapt and change and improve. So that's the idea behind this. Next slide. So again, the idea of brain envy. Okay, at 60 years old, you can have Alzheimer's. If you have sleep apnea, being overweight, lack of oxygen, we just talked about that. Chronic oxygen deficit can affect the brain like this. So I kind of downplayed a little bit with mask. I mean, if you just really overdo the mask, you can have something similar to like this happen. So it will affect you. So hopefully the whole mask mandate or whatever will not really come to fruition. But I'm sure there's a big debate about that. And then the right slide is a healthy brain. It's a 60-year-old person with different kind of conditions and how the brain function changes.
That is crazy.
Depending on this. Isn't that amazing?
What's so crazy is when you look at the Alzheimer's brain, and you just look at how deteriorated it is.
Yeah.
And so what I want to know is, okay, if you had a brain scan when you were younger, could you see that there's a potential risk for you to get Alzheimer's in the future?
Yes.
Okay.
Yeah. There are a couple of signs that kind of give you a clue.
Okay.
Almost even up to almost 8, 9, 10 years before this would happen.
Right.
There's a clue that you can see that there's a risk of this happening.
Okay.
And you can actually do preventive measures.
That's amazing.
Yeah.
That's amazing.
Yeah.
I love that. And then the second scan was the scan of somebody
with the sleep apnea.
with sleep apnea,
Yeah.
and then
So
overweight.
overweight,
So
so he does not get breathing well.
Well, and here's the thing: is what people need to realize. Your sleep is important.
It's everything.
It's your sleep is so important, and that's another
Yes.
thing when people are stressed. They don't sleep well.
Right.
They don't sleep well. We need to be sleeping well,
I
folks.
know,
You
I
need to be
know,
not
same.
worrying. You need to be
Exactly.
exercising.
I'm
You
telling
need to
you.
be taking care of yourselves, to take your vitamins, work out, turn off the mainstream media.
Yes.
I mean, honestly, because if you get sucked in, if you get sucked into this plan, to this propaganda, to this negativity,
Yes.
you are harming yourself.
yeah. All the
you are
negative energy and
damaging your
stress,
brain.
yes.
You're harming your body.
No.
We can't get sucked into it.
Well, I mean, there's a whole stress cycle, and we talk about exactly what you're talking about, right? Stress. So stress releases different hormones,
Right, cortisol.
Mainly cortisol, yeah. And you know what that does?
Right.
Screws everything up. So at night you can't sleep. And if you do it long enough, your sleep cycle completely changes, and your hormones change, and you're up all night because you're stressed, and even if you sleep, your sleep is not good quality, right? So that has a huge detrimental effect in everything, but certainly your brain.
Yes.
So anyway,
Right.
let's just finish this. We got a couple more slides to do, and we can just wrap it up. Next one. So again, back to the diamond. And so brain health is part of the entire evaluation, including HDL testing, hormones, nutrition. I look at all those kind of things to support the brain, because if you look at the diamond, you can put I have the brain on the bottom, but if you flip it over, the brain's on top. Everything is supporting the brain, so to speak. So you can kind of look at it that way. So all these different factors are tremendously important in supporting the brain. And then I work with other professionals. I mean, I do a lot of this work, but I'm not expert in all these things. So I work with psychiatrists, different therapists, nutritionists, trainers, chiropractors. I mean, anybody that I think can help you to improve your body and health, I'll send you to them. If there's something that I cannot take care of myself, I'll refer you to those kind of people to really help you. So it's a multifactorial, very comprehensive evaluation, not just the brain scan. Brain scan is actually the starting point. It's not the end point. And I use that information to really try to help you and kind of retune your brain and health from that information. Next one. So you can't treat what you don't see. Okay, this really is the key for entire things medicine. If I can't see what's going on with you, I have no idea. How am I going to treat that, right? Same thing with the brain. So the Spect scan allows you to see the brain in how it functions. That really is the key, and this is the only tool we have that really does that. So for those of you out there who are interested in maybe evaluating this or just want to talk about it, this is the phone number to my office. Please call and set up a consultation, and we can spend half an hour talking about it and see if the scan that might be beneficial to you in terms of giving you some ideas and giving you some direction into how you might want to progress with your life. Next slide. I think that's the last one.
Well, what I love about this is.
Can you go back to the next one? Just leave it there. So
What I love about all of this is that you're one of the
3
only
minutes.
physicians in the entire state of Texas. If you might be the only
No,
physician.
I'm not only. I'm not the only one.
But you're
But
one of the
yeah,
only
one of the few,
physicians
very few, yeah, one of the very
that
few.
does this.
Yeah.
And I know that with everything you do, you treat your patients like a partner.
Yeah.
And that's
Yeah.
another reason I think that it sets you apart from any other physician I've ever come in contact with. So I thank you so much for
Thank
sharing
you.
this with
Thank you
us.
very much. Okay.
And now we
Okay.
can.
No, you can.
Yeah, we can.
Oh, there you go. Okay.
Yeah. Hey,
Now
listen,
we're back.
we're not in our normal
Yeah.
studio,
Yeah,
as you
exactly.
know. We
Yeah.
kind of have been spoiled in that other studio. Not that there's anything wrong
No,
with
this
this
is great.
studio,
This is
because
fun.
this studio
Yeah.
is amazing. We
Yeah.
love the studios here at Real News, but we've really been spoiled over there
I know.
at that studio, and we'll be there next time.
Exactly.
So we thank you so much for tuning in.
Yes,
Please
definitely.
share this once you get it. Share it. And let us know if there is a topic that you'd like us to cover. We are still looking for people that would like to have come on the show and
Yeah,
get
get some
Botox
Botox,
live.
yes,
And
exactly.
if y'all don't do it, then I'm going to have them
Okay,
shoot.
sounds great.
Then I'm going to have
Should be
them
the
do
guinea
it to
pig.
me. Okay, so if you're interested, please,
Yeah, just let us know.
please let us know. So
Yeah.
until we meet again, share your love.
And live healthy.
Bye bye.
Bye.